Chemical Dependency Program presentation for Liberty University presented by Joseph DesJarlais. What is chemical dependency? What is its complexity? Chemical dependency is a complex disorder that can involve virtually every aspect of an individual's functioning. It can be in their family, at work, school, even in their community. A chemical dependency treatment center is a facility that offers a safe and supportive environment for anyone addicted to or dependent on drugs or alcohol. If you have a loved one or yourself who abuses substances, a treatment center can help a person in their journey to recovery. Because of addiction's complexity and pervasive consequences, drug addiction treatment typically must involve many components. Some of those components focus directly on an individual's drug use. Others, like employment training, focus on restoring the addicted individual to productive membership in the family and society, enabling him or her to experience the rewards associated with abstinence. Treatment for drug abuse and addiction is delivered in many different ways and settings. They use a variety of behavioral and pharmacological approaches. In the United States alone, there are more than 14,500 specialized drug treatment facilities that provide counseling, behavioral therapy, medication, case management, and other types of services to persons with substance use disorder. Along with specialized drug treatment facilities, drug abuse and addiction are treated in physicians' offices and mental health clinics by a variety of providers. These can include counselors, physicians, psychiatrists, psychologists, nurses, and social workers. Treatment is delivered in outpatient, inpatient, and residential settings. Although specific treatment approaches often are associated with particular treatment settings, a variety of therapeutic interventions or services can be included in any given setting. Funding and managed care. Because drug abuse and addiction are major public health problems, a large portion of drug treatment is funded by local, state, and federal governments. However, there are private and employer-subsidized health plans that may also provide some of the coverage needed for treatment for addiction and its medical consequences. Unfortunately, managed care has resulted in shorter average stays, while a historical lack of insufficient coverage for substance abuse treatment has curtailed the number of operational programs. The recent passage of parity for insurance coverage of mental health and substance abuse problems can hopefully improve the state of affairs. In the healthcare reform, or the ACA, it may also increase the demand for drug abuse treatment services and present an opportunity to study how innovations in services, delivery, organization, and financing can improve access to and the use of drug treatment facilities. Outpatient treatment programs and intensive day treatment. Outpatient treatment varies in the types and intensity of services offered. Such treatments cost less than residential or inpatient treatment and often is more suitable for people with jobs or extensive social support. It should be noted, though, that low-intensity programs may offer little more than just drug education, which may not be suitable for someone suffering from chemical dependency. A more intensive program may be needed, where the intensive day treatment could be applicable. Other outpatient models, such as the intensive day treatment, can be comparable to residential programs in services and effectiveness. Depending on the individual patient's characteristics and needs, in many outpatient programs, group counseling can be a major component. Some outpatient programs are also designed to treat patients with medical or other mental health problems in addition to their chemical dependency or drug disorder. Individualized drug counseling. Individualized drug counseling not only focuses on reducing or stopping illicit drug or alcohol use, it also addresses related areas of impaired functioning, such as employment status, illegal activity, and family and social relations, as well as the content and structure of the patient's recovery program. Through its emphasis on short-term behavioral goals, individualized counseling helps the patient develop coping strategies and tools to abstain from drug use and maintain abstinence. With the addiction, a counselor may encourage a 12-step participation program. This will help them in making referrals for needed supplemental, medical, psychiatric, employment, and other services that may be needed for the patient. 12-step programs. There are many different 12-step programs out there for substance abuse, alcohol, drugs, but all of these programs, they all have the same end goal for an individualized program to ensure that that person maintains accountability of their actions and that they have a willingness to change. In the 12-step program being submitted, the first step would be admitting the powerlessness over the addiction. The second step, believing that a higher power can help. 3, deciding to turn control over to that higher power. 4, taking personal inventory. 5, admitting to the higher power, oneself, and other persons of the wrongs done. 6, being ready to have the higher power correct any shortcomings in one's character. 7, asking the higher power to remove those shortcomings. 8, making a list of wrongs done to others and being willing to make amends for those wrongs. 9, contacting those who have been hurt unless doing so would harm the person. 10, continuing to take personal inventory and admitting when one is wrong. 11, seeking enlightenment and connection with the higher power via prayer and meditation. And 12, carrying the message of the 12 steps to others in need. Why should an employer have a chemical dependency program? Well, it values the employee and understands that there may be issues in their life and gives them a way to seek help if they need it. While keeping their employment intact, employees may go through medical procedures, whether they are or are not related to work or workplace accidents, and why they may be legally prescribed painkillers during that time. They may end up developing a dependency. Having a program shows understanding of this and gives a way for the employee to seek assistance. With a program in place for chemical dependency, this can also give the employer some legal protection in case of an incident. In closing, in the 90s, we saw a lot of oxycodone being the very popular pain medication to be prescribed. Doctors were saying it's not addictive. And now we're finding out, fast forward to today, and we're finding out that that's just not true. We have an opioid crisis, a lot that stems from pain medications. We're seeing this crisis move throughout our country, and people who are prescribed these medications to help with their pain are now chemically dependent. This crisis is affecting a lot of people who were otherwise good members of society, but now they're self-medicating. Just because they have nowhere else to turn. In the workplace, employees can be injured on the job, and depending on the type of work or injury sustained, this could result in surgeries. And with surgeries comes prescriptions, sometimes prescription pain medication. With these prescriptions, the ones that are prescribed it could develop a dependency on their legally obtained substance. Once the prescription runs out, that doesn't mean that the person's need for it does. Often when this happens, an individual starts seeking self-medication. This can affect every aspect of a person's life: work, family, leisure, even the legal aspects of their life. It is important for employers to give their employees a safety net to fall back on and be able to seek treatment if it is ever needed.